much. I'm very happy to be here, and especially happy to see a room full of people that are interested in global health and concerned about global health. I will pick up on what Dr. Hansen was saying about making these new tools accessible to those that actually need them. I have spent, I would say, about 6 years working in the field building capacity. And with building capacity, in some instances, just like Rachel just said, there was absolutely nothing. We really had to bring up even the basics like electricity and water in order to conduct research. So, and also I am from Cameroon. I was just in Cameroon about a month ago, and I can see being in the field working or being in Cameroon at a personal level, just how much is needed. You know, we are here in Washington, D.C., quite removed from these remote places where there's so much needed. But the need is there, and I'm very happy to see that organizations such as USAID, and especially the US government, how much of an investment is being put in. But we definitely need to do more and to advance and to help global health in general. I'm going to talk about specific examples about my work, just to kind of put you there with me as I was there. While at ERIS, we had a professional development program which was focusing on building skills and creating an avenue for growth for each individual on our research teams. Now, we did research in Uganda, Kenya, India, South Africa, and in some teams we had about 90 staff members. Of course, we were concerned with doing the research at hand because ERIS's mission was to develop new TB vaccines. So we had a research at hand that we had to conduct, but also the spin that we put on it was to actually create a path for growth for each individual. For example, we hired a woman as a housekeeper in South Africa. While she was working as a housekeeper, she was also allowed to take classes within the program to learn about being an outreach worker. So a couple of years later, she did become an outreach worker. So each individual in the program had a curriculum to follow, all the way to the investigators. I'm bringing this up because we cannot just think about the task at hand. We have to think about sustainability and the future. What happens when the researchers are gone? What happens when the sponsors are gone? How are these sites, how are these countries going to maintain and sustain with the infrastructure that was brought to them? There are many examples. In Uganda, ERIS was doing research in Uganda, which is about 150 miles from Kampala, the largest city. So we were to roll out 2 epidemiology cohort studies. With altogether, we were to enroll about 7,500 infants. Now, we needed a data manager. It's not that there are no data managers in Uganda, but there are very few and a lot of need. So the pool of talent that we had was quite small. Sometimes we just had to go with motivation in the candidates that we were looking at. So we hired a young man who was right out of university with an IT degree. We spent about, I would say, 3 to 6 months with heavy, intensive training for data management and clinical research, with day-to-day coaching, experts coming in and spending some time with him on a daily basis. And now it's 2 years later, he is managing that site in terms of data. So I can see how with the effort and the investment that can be made, that health systems in general for countries can be strengthened, and then we can make strides in improving global health in general. As Dr. Hansen was talking, I remembered, and this happened just about a month ago when I was in Cameroon. I was in a very remote place in northwest Cameroon. It took us about 6 hours to go 350 kilometers by car, so very remote. And I saw them rolling out a vaccine campaign. This was a tetanus vaccine. They were very well organized. They had been working with UNICEF. This was the Ministry of Health, working with UNICEF, very well organized in how they were giving the vaccine and obtaining the best coverage possible. But they were recording data on paper, and then they called out paper to the closest fax machine that was quite far, and it wasn't easy to get back and forth from where they were working. And then fax that data to the Ministry of Health in Yaoundé. They were expected to do that in 2 days. Impossible. But what I noticed, every single person there had a cell phone. And I know from being here that there are technologies, using the cell phone technologies that would very easily make them so much more efficient. But in many instances, you have to be there to see it. In other words, there's a lot of work to do. We definitely need the science, we do need the technology, but I also want to put emphasis on the management skills, leadership skills in governance, that and also quality. I think that will kind of round out the package when we talk about innovation in global health. Thank you.